The second principle is visibility, illumination and retraction. When we say visibility, it is either direct visibility or indirect visibility. Direct visibility is I directly see the tooth without aid of any mouth mirror or any other reflecting devices. Whereas indirect visibility is with the help of mouth mirror, I tend to see the areas which I am not able to see directly. Direct visibility is when we see the teeth directly. Whereas indirect, I'll use the mouth mirror and I'm visualizing the palatal aspect of upper anterior teeth. Likewise, certain areas I may have to see directly, some areas we see indirectly. We can change our chair position. It may be 7 o'clock, 11 o'clock, 1 o'clock, 12 o'clock, and accordingly see some of the teeth directly. For example, if I move on to the 12 o'clock position, I'll be able to see the lingual aspect of lower anteriors directly. Whereas if I have to visualize from 12 o'clock position, if I have to visualize the labial aspect of lower anterior teeth, it has to be through the mouth mirror. So as per our convenience, we can change our position and try to visualize either directly or indirectly. Illumination is with the help of dental light. The principle to be followed here is, first principle is the light should be one arm away from you. The reason is very simple. It is accessible to you if it is kept one arm away and it is not too close to the patient. Why it should not be too close to the patient? Let's say I keep it very close to the patient package. Let's say patient gets up and uses the spittoon to raise the mouth. It would obstruct the movement of the patient. Likewise, it may even obstruct the movement of the operator. So, it's safer to keep at one arm distance and then adjust the light. The maxilla and mandible are in different planes. So, the light arrangement, the position of the light also changes for maxilla and mandible. When the patient opens the mouth, this is the maxillary plane. Open, please keep it open. So if I have to adjust the light for maxilla, this is the right position. The light falls directly on the maxillary occlusion plane. The same position may not be correct for the mandibular teeth. If I keep this position for the mandibular teeth, the shadow of the anterior teeth will be falling on the posterior teeth. So for mandible, I'll be kicking the light here and adjusting the light on the mandibular arch. The light will be directly focused on the mandibular arch. Depending on whether you are doing for maxilla or mandible, you can arrange the light position. Done by the mouth mirror or fingers of the non-operating hand. With the mouth mirror, we should be using the non-reflecting surface of the mouth mirror to retract cheek or lip. So I am using the non-reflecting surface of the mirror to retract the cheek. Likewise, if I have to use fingers of the non-operating hand, I'll be using, so my operating hand is right hand, so I'll be using my left hand to retract the